Today we just learned of the Supreme Court ruling when it comes to the President's health care plan. And we'll all certainly respect the Supreme Court's decision, but I think it's fundamentally important that we respect the needs of the American people. Here are the facts. The President's health care plan is hurting job creation in this country, hurting health care and increasing costs. As I've traveled throughout the 3rd Congressional District, I've visited with senior citizens who are not able to access health care because of the President's plan. They stripped out $575 billion from Medicare, hurting health care for our senior citizens when they deserve to be able to have it provided. We need to address that. We're seeing that the IPAD board is going to be put into place, making those medical health care decisions for our senior citizens and for others, when we shouldn't be getting in between that doctor-patient relationship. Here's the real truth. The President's plan has not addressed affordability and accessibility, issues that we can all agree on. We can all agree that we need to be able to make sure that we have provisions for people with pre-existing conditions. If we want to be able to provide for our children to an older age, the age of 26, that should not be impeded. But the President's health care plan is not addressing what is fundamentally important to all of us, and that is that affordability and accessibility. We have to come up with a real plan for America's future when it comes to health care. We're going to be putting forward ideas to address those real concerns, to be able to drive down costs, to be able to make it affordable, and most importantly, to make sure that health care is actually accessible for the American people as well. Let's allow us to be able to buy across state lines. Let's let real competition work in the marketplace. Let's incentivize rather than punish people for having individual medical health care savings accounts. Let's make those provisions for people with pre-existing conditions, and if we want to be able to provide health care for our children and pay for that insurance, we certainly shouldn't be inhibited from that either. Lowering costs through those increased plan options and market competition, those are good ideas which will address the real challenges that we as Americans face. Strengthening and preserving Medicare and other critical programs for our senior citizens is something and a promise that we must truly fulfill. The President's health care plan, again, fails at all levels when it comes to actually standing up for our senior citizens and protecting that doctor-patient relationship and making sure that we're safeguarding our private health care information as well. These are all pieces of legislation which we will be putting forward, and we're going to be addressing the real concerns and needs of the American people in the coming days. Why is this so important? If the President's health care plan is not removed and repealed, this is the jumble of the bureaucratic malaise that is going to really impede our ability to provide that health care. Decisions that are going to be made in Washington. I don't think that any of us can forget that right now we're facing a $15.8 trillion debt in this nation. The President's plan, when it was originally sold to us, was only going to cost $900 billion. CBO recently came out with new figures, saying that when you include administrative costs, it's now going to exceed $2 trillion, on top of the massive debt that is already accumulated in this nation, which is burdening our ability to be able to grow our economy and is a threat to all future generations of American. Building out this type of a government-run healthcare program is going to continue to cost more dollars. It's not going to make it easier for our senior citizens and ordinary Americans to actually be able to receive health care. It's going to make it harder. There are better ways and a better path, and we are going to continue to fight for it. When we're talking about the real costs that every American is paying for their health care right now, the President had promised us that it was going to save us about $2,500. In terms of real costs for an average family of 4 by the year 2021, it's going to cost better than $32,000 for health care. This is not achieving the real goal of affordability and accessibility when it comes to American health care. Again, there are better solutions, and we are dedicated to making sure that we are addressing those. Right now, when we look at the actual cost in terms of our economy as well, 74% of our businesses, according to the U.S. Chamber of Commerce, are finding that they are not able to hire new people because of the developing program of the President's health care plan, and impeding our ability to be able to create jobs and to be able to get Americans back to work, and again going back to affordability and accessibility. This is a program whose intent may have been well intended, but the fact of the matter is it does not achieve that goal. Affordability, accessibility, standing up for our senior citizens is something that the President's Health Care Plan fails at all levels. We're going to be putting forward legislation to address the real concerns that impact real Americans and real American families. We're going to try and achieve those affordability and accessibility issues and deliver that health care that Americans deserve and need. But it doesn't need to be coming out of Washington, D.C. with another big government program.